on this week's episode of Monsters Inside You.
Hey, Dr. LaVarnway, can I ask you a question?
What?
I think I need a day off.
A day off? What for? It's not like I have you doing anything dangerous. You missed a spot.
Where?
Right there. Clean it up. Hey Ash, can you go in there in a few minutes and clean up? One of the cats made a you-know-what, a huge one, and I'm going to lunch, so.
Yeah, I know, but I'm not feeling so well.
What are your symptoms?
I feel like I have the flu. My lymph nodes are swollen, I have a fever, and my muscles ache.
Nurse!
Yeah, Doc.
I need you to get me the book.
What book?
The book!
Get in the book. Get in the book. Here. Here's the book with all the book stuff.
Oh. Yes, just what I suspected. Toxoplasma gondii.
What?
Toxoplasma gondii.
Toxo what?
Toxoplasma gondii!
Alright, sir, do you know what Toxoplasma gondii is? You don't know? Do you know what Toxoplasma gondii is?
Isn't that an STD?
Do you know what Toxoplasma gondii is? Do you know what Toxoplasma gondii is?
Not a clue.
Do you guys know what Toxoplasma gondii is?
No. It's like some cat disease.
Toxoplasma gondii is an internal parasite. Specifically, it is an intracellular protozoan that causes the disease toxoplasmosis.
Dun, dun, dun. Meow.
Toxoplasma gondii is found in cats, birds, wild animals, as well as humans. Members of the cat family, however, are the only known definitive host for this protozoan.
What is the life cycle of Toxoplasma gondii? I don't think they taught me that at Cornell.
This diagram explains the basic life cycle of Toxoplasma gondii. Toxoplasma gondii gets excreted by cats, and the oocysts go into the feces. Feces are ingested by the intermediate hosts, which in this case is humans. The oocysts then enter and proliferate in the cells of the intestine and associated lymph nodes to form tachyzoids. Tachyzoids are the active feeding form of this parasite. The tachyzoids spread to all other tissues of the body where they invade the cells and multiply rapidly. Another scenario is that tissue cysts containing bradyszoids will form in the brain, the heart, the liver, and the skeletal muscle and can eventually cause death.
How does Toxoplasma gondii affect people like me?
Pregnant women can pass the parasite to their fetus by transplacental infection. In the U.S., more than 3,000 babies are born every year with ocular lesions from Toxoplasma gondii.
So, how do you prevent Toxoplasma gondis?
There are many ways to prevent the transmission of Toxoplasma gondii. Meat should be thoroughly cooked. Rare or uncooked meat should never be fed to cats. Litter boxes should be cleaned daily. Hands should be washed thoroughly after changing litter boxes. Pregnant women should avoid handling cats and definitely avoid cleaning litter boxes. Gardening with gloves and washing all fruits and vegetables is also important. Sandboxes should be covered to prevent cats from using them as litter boxes. And cats should be prevented from hunting when at all possible.
Most healthy people can recover from toxoplasmosis without treatment. People who are ill can be treated with a combination of drugs such as pyranthymine and sulfadazine plus folinic acid. Pregnant women, newborns, and infants can be treated, although the parasite is not eliminated completely. The parasites can remain within the tissue cells in a less active phase because their location makes it difficult to completely eliminate them. People with a compromised immune system need to be treated until their condition improves. For AIDS patients, continuation of medication may continue for the rest of their lives.
Nurse, tell me again why I have to be doing this.
I don't know, Doc. She's pregnant. They got the toxo. She can't do when she's pregnant.
I'm a graduate of Cornell. I shouldn't have to be doing these things.
You missed a spot.